think there are two important things to say about the book. The first is that although the NHS seems invariably to attract huge amounts of political vitriol, the book is not grinding any party political axe. Certainly for me, and if I think of my own relatives, they've suffered under governments of every colour, if you like. So in as far as politics is involved, for me it's a curse on all their houses if they're responsible for this state of affairs. The second thing, which is also very important, is that it's not a book that's saying the NHS is a terrible service. There are certain areas of healthcare that are very good. Even when it comes to the care of older people, there are some hospitals that are better than others, and within those hospitals there are some wards that are very good. Equally, there are others that are not so. It really must be emphasised that the book is saying there might be considerable amounts of good practice in the health service, but logically, to say that because there's good practice we don't have to worry about the appalling practice, of course, is a logical absurdity. And what the book is saying is that there is now a substantial seam, a substantial stratum of extremely bad practice, which year by year is affecting more and more people. And maybe the sensible way to put this is what the Patients Association has said in a couple of its recent reports, that even if this very poor and neglectful care affects only a small percentage of overall of patients treated by the NHS, that can still amount to hundreds of thousands of people a year. And perhaps that's the best way of putting what the book's getting at.